We are back with an effort to bring more awareness to a skin disease that affects more than 30 million Americans, and many of them are children. October is known as Eczema Awareness Month, and joining me now is Dr. Ingraham from Advanced Dermatology. Thank you so much for being here. So I was just talking to you in the break. I personally know how frustrating eczema can be. Talk a little bit about what it is for people who maybe are not familiar.
So eczema is an interesting condition. It's a genetic condition. It's also involving our environment, how our skin interacts with the environment, and really it comes down to our skin barrier. Our skin barrier is designed to not let too much water in or too much water out, but an eczema skin barrier becomes leaky, pathogens, allergens get in, the skin barrier gets irritated, scaly, itchy, weepy, crusty, and can really affect the quality of life of both children and adults.
Absolutely. It's frustrating because some of the treatments can be different and they're changing. You talked a little bit about that during the commercial break.
This is a really exciting time. So for the first time in over 10 years, there are new FDA-approved drugs for eczema. So in the past, we mainly used topical steroids. Well, we have two new players in the marketplace today. The first is a phosphodiesterase inhibitor. It's a topical cream called Eucrisa, and it's really exciting because it's a steroid-free ointment. And so it's FDA approved for children and adults over 2 years of age. You apply it twice daily. And so for a really bad eczema flare, a severe eczema flare, you may want to use your topical steroid, but now you have another agent that's steroid free and very safe for children and adults to use.
Right. We were talking about how steroids, you can get accustomed to some of these treatments.
Right.
And then they lose their effectiveness, which is part of why eczema is so frustrating. I can only imagine how frustrating it is for children.
It is. You know, with children especially, they can't really vocalize, but they're scratching themselves, and studies have shown they have a decreased quality of life. The parents do, but also it can affect their school performance because they're not sleeping. So the number one thing we like to convey is skin barrier protection. Using a proper skin barrier product, whether it's a prescription medication like Episerum or ceramide-containing products like your CeraVe products. These can all help to prevent the leakage of lipids and moisture from the skin barrier and prevent those flare-up periods.
Okay, so say somebody's watching this and they think, maybe this is the problem that I'm dealing with. What should they do?
So they can first start with over-the-counter medication. So you can try products like La Roche makes a line of products, Lipicolor and Tolerian, also CeraVe that help to protect the skin barrier. You can try over-the-counter steroids. If you are not getting relief, you need to seek the help of a dermatologist, because this is not only an illness that causes itching and causes a lot of decreased performance in school and some embarrassment also when you have this rash, but it also can lead to infections because you're chronically scratching that broken skin barrier and they can get secondarily infected.
Yeah, lots to talk about, lots to learn. Thank you so much for joining us, Dr. Ingraham. Again, Eczema Awareness Month. We really appreciate you being here.